custody wants to take the vaccine, they should be able to immediately. And so we just want to make that clear, that access is what we're asking for. We'll be discussing both the vaccine and the pandemic, and why today's prison population, incarcerated people, prison staff, and correctional officers should be among the first. And our amazing guest today is Professor Hadar Aviram, Professor of Law at UC Hastings School of Law. And if you did any time in prison, or if you're an advocate, you know that the UC Hastings School of Law has done quite a bit of research and has been an ally to people that are in custody for many, 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 many years. So without further ado, I'd like to introduce Professor Aviram. Please introduce yourself and share with us, what have you been doing in criminal justice reform work as of late, and maybe a little bit historically, so people can get to know who you are.
Sure. Hi, everybody. It's so nice to be here. Thank you to the Anti-Recidivism Coalition for inviting me, and thank you, Sam, so much for having this conversation with me. For those of you who don't know me, my name is Hadar. I'm a law professor at Hastings, as Sam said, and most of my work is on criminal justice policies. I have 3 books out. The first is called Cheap on Crime, and it's about what happened in California punishment after the Great Recession of 2008. My most recent book, it's called Yesterday's Monsters. It just came out this February, and it's about California's dysfunctional parole process. I'm using the cases of the Manson family murders to show what problems there are with the parole process, what kind of questions are going on at the hearings, how everything is politicized. So that's what that book is about. And that work, which mostly focused on the plight of folks that are aging and folks that suffer from all kinds of chronic conditions behind bars, made me extremely interested in COVID-19 when the pandemic broke. I was one of the first people to try and draw attention to this and ask prison officials throughout the country, but especially in California, to start releasing people. And I've been working with just countless wonderful people to try and bring about some rescue to folks that are facing illness and facing horrible consequences from COVID-19. I have a couple of articles out on COVID-19. I'm going to drop the links in the chat later when the Q&A starts, so you can have them, in which I discuss why we are in the mess that we are, because there are chronic conditions and problems that go back decades that have basically created this sort of petri dish that we now have in our prisons. I've been involved in 2 litigation efforts, both of which involved the outbreak in Quentin. So I represented the ACLU of Northern California and 17 of my colleagues as amicus, which is friends of the court, in the litigation in Von Steitch, which resulted in the Court of Appeals order last month to bring down the population at San Quentin to 50%. And we're now working hard to try and make sure that that actually happens, and doing everything we can to pressure CDCR that they don't just move people around, increasing the risk, but actually take a hard look at whether all the people that are behind bars really need to be there. So that's basically been what I've been doing on this in the last few months. I'm also working on a book in progress about the COVID-19 crisis in California prisons.
Thank you so much, and thank you for the work that you're doing on behalf of everybody that's in custody, and the work to be able to make our system both safer and more equitable. So right now we're in the middle of a global pandemic. Even California, like the governor just put out new restrictions. County of Los Angeles, new restrictions. It's affecting all of us, especially our community members that are currently incarcerated. This process is moving fast. The vaccine process is moving fast, as it should. And for our audience, who and what entity is spearheading the decision of making the determinations about the vaccine in California? Can you put that in context? Like, who is making the determination of who will be able to have access to the vaccine first?
Sure. So the California Department of Public Health is the entity that's in charge of figuring out the vaccination plan, how to distribute the vaccine, and all of that. And they've created a statewide vaccination plan, which consists of 3 phases. In phase 1, they're expecting that we're going to have potentially limited doses, which is true. We already know that we're going to get a few 100,000 samples of the Pfizer vaccine. We're not going to get enough nearly for the many millions of people who are living in California. And the idea then is to figure out how to prioritize the people who need to get the vaccine first. Then there's going to be phase 2, when there's going to be more doses available. And then there's going to be phase 3, which is basically continued vaccination and gradually shifting to a routine strategy. Now, during this phase 1, when we're going to have a limited supply of vaccines, what the California Department of Public Health is going to do is focus on what they call critical populations. And they break this phase into 2 phases, 1A and 1B. In phase 1A, they're going to prioritize healthcare personnel that are treating COVID patients and healthcare personnel that are likely to be exposed to COVID-19. In phase B, they're going to target folks that are at increased risk for severe illness or death and essential workers. And they've put together something called the allocation data team. And the allocation data team is tasked with trying to identify who these critical populations are, how to get the vaccine there, to engage in some work with public education and outreach, and basically get people to come on board of the vaccination plan. So that's the overall plan. Now, when they put together this plan, they're getting information from lots of state agencies about the prevalence of the disease, the sensitivity, what the kind of demographics of the population are, and they list dozens of state agencies, only one of which is CDCR. So they are getting input from CDCR, but prisons are not explicitly mentioned as one of the populations that's going to be prioritized in phase 1.
Okay, so let me understand and want to make sure that our audience understands. So people in custody are not in phase 1, but staff are, or staff are not?
So we don't know about staff that's not medical staff. I assume that when they prioritize healthcare personnel, they mean prison doctors as well, just like doctors anywhere else. I don't see anywhere in this plan anything about other prison workers, such as, for example, correctional officers or kitchen workers or maintenance workers. So there's nothing about those populations that don't work in healthcare in this plan yet.
Okay, so that's definitely something that and I'm a layman. I'm not an expert in this field, but I would think if, for instance, SADF right now has a huge infectious rate right now. How do we stop that? One, like right now, let's say next month it's another institution and we're having this problem. Wouldn't it be smart? And again, I'm a layman. I'm not certain of this, but wouldn't it be smart, because you're going to have healthcare workers that are there, doctors, nurses, medical technical assistants that are helping people that have tested positive, and staff, both people in custody and staff. Wouldn't it be smart to offer the vaccine to them then? In order
So absolutely, precisely because in the context of a prison, staff, not necessarily medical staff, come in such close contact with people that it's essentially the same kind of close contact that you have with healthcare workers on the outside. So just because of the structure, and this is one of the things that I've been trying to explain. I have an op-ed in the Chronicle about this from this morning. I've been trying to explain that you can't really understand how urgent it is to solve the prison problem unless you pay attention to the architecture of prisons, to how they're built, to the impossibility, given what we're seeing right now, of social distancing and properly taking care of people, the history of healthcare in prisons, and to where prisons are geographically with the surrounding communities, which we're going to talk about as well, I hope. Like, it's impossible to fashion a solution unless you take all of this into account. And this is why I think that taking care of the prison staff, and I'm thinking doctors, social workers, psychologists, volunteers, maintenance workers, kitchen workers. There's a lot of people who work in California prisons in addition to correctional officers. And all of these people, I think, need to be prioritized.
So I think my next question is going to actually, when we talk about surrounding communities, because you were one of the attorneys that represented people in San Quentin and Marin County, and their healthcare system was overwhelmed when they had the huge outbreak there. And so, in your writing and in your Twitter thread earlier this week, you made the case for prisons; they must be designated as vaccine priority sites. So I'm assuming part of the reason for that is because what you've already said is it's impossible to social distance, but also the impact that directly has on the surrounding communities.
Exactly. One of the greatest misunderstandings that politicians have about prisons is they think of prisons as these closed places where nobody goes in and nobody comes out. Like there's only these 2 points of contact, right? When somebody comes in and starts their sentence and when somebody, comes back home to the community. But that's not actually true. This is not how prisons work at all. Prisons are completely porous. People come in and out of prison every day. Hundreds, thousands of staff come in and out of prison every day. Volunteers, lawyers, like the visitors. There's a lot of people who come in and out of prison every day. And this is something that is obvious to geographers, it's obvious to epidemiologists, it's obvious to criminologists, but it's not obvious to politicians. And this is partly why in the last few decades, we've seen this philosophy of incapacitation, right? Kind of like we've given up on helping people, rehabilitating them, offering them programming. Like the basic idea is incapacitation, kind of like we, meaning the outside community, are safer from them, the folks that are still inside, if we lock them up and they're somewhere else. But this completely misunderstands how a prison works. So for the last few months, my partner and I are working on a book in progress about the COVID-19 crisis. And what we've done is we've collected all the data that CDCR puts up. And I know there's a lot of problems with that database, but that's the best we have. We've taken all the numbers on the infections in prison, and we're basically overlaying it over the numbers we get from the LA Times for the entire state. And guess what? True, we can't tell an airtight causal story because we don't have contact tracing or any of the things that, a decent country should have. But with what we have, I can tell you there is a correlation between spikes in prison and spikes in the surrounding and the neighboring counties. This is partly why, and this again is a story from Quentin, but it repeated itself in other prisons as well. When the big transfer happened from CIM to Quentin, many of the people on the call know this. When the big transfer happened, Matthew Willis, who's the healthcare official of Marin County, actually contacted St. Quentin and said, look, I know there's 122 people you just brought in. Please test them. Please quarantine them. What he got in response was a form letter from the CDCR Attorney General Counsel saying, you're a county authority and we're a state authority. This is not a good way to think about this. This is all happening in the same geographical plane. If people in St. Quentin get sick, people in Marin County get sick. If people at SATF are getting sick, people in Kings County are getting sick. This is just the way a virus works. The virus doesn't read the penal code. The virus can't tell who's doing time and who's not time. All the virus sees is available hosts. And this is why vaccinating folks in prisons or convincing people to get on board with a vaccine should be a priority, not just for those of us who care about our loved ones and our friends behind bars, but for everybody in the system. Everybody needs to care about what's going on because all of our collective health depends on each other.
So first I want to lead up to a second question, but first, when Chino prison, which had the first big outbreaks and a number of deaths long before San Quentin was affected. And I've said this before and I say it again, there was not much outcry. There was not much being done. And then when it hit San Quentin, there was like, immediately there was a response almost. And I attributed that, and I still stand to the point that part of it was because of the county, the power, wealth, and influence.
Exactly.
Privilege. When they were in a county that was less or had less affluent people, then it was almost like, okay, those people can die in those cages down there. And I'm not saying that's actually what the thinking was, but it seemed to be that way. And now here we are.
So this is exactly right. And I think this is part of the reason why the outbreak in Quentin got so much attention. I mean, rightly so, right? The outbreak in San Quentin, I should say, is the worst outbreak of COVID-19 in the entire country and is the worst medical disaster that happened in a prison in the United States ever. So let's keep that in mind. But also let's keep in mind that San Quentin benefits a lot from its proximity to the Bay Area.
Absolutely.
For decades, people wanted to move to San Quentin and do time in San Quentin because that's the only place they had access to programming. The state was cutting programs. When I wrote yesterday's Monsters, I talked to lawyers who had to give folks self-help books to read about anger management and whatever because they simply couldn't find programs to show the parole board that they've taken, rehabilitation programs. As opposed to San Quentin, where again, there's a complete vacuum with the state, but volunteers and all kinds of do-gooders from the Bay Area step in and help. This is not available in the poor rural places where small towns have been sort of enticed to bring in the prison with this false hope that having a prison there was going to improve the economy. And because of that, we have this kind of squeaky wheel gets the grease situation and not enough attention to the horrible outbreaks in other places. Avenal had 2 outbreaks, one after the other. You know, California Institute for Women had 2 outbreaks with hundreds of cases for each one. And I'm talking people that could be released because they have 0 risk of reoffending. So truly, like, they are less likely to reoffend than anybody on the outside. So I think to some extent the focus on Quentin, even though it's merited just because the scale of what was going on, is kind of overshadowing the fact that we're talking about a disaster that is happening statewide, system-wide.
Okay, so thank you for that, Professor. Historically, people of color, especially African Americans, have had a huge issue with trust when it comes to science, when it comes to doctors, hospitals, our country, the prison system. We had the Tuskegee experiments, and many other times in which we were experimenting on. Even when we first came to this country, there's huge documentation on how, like, we were just guinea pigs. People in prison have been guinea pigs, and so. And I feel that I remember when I was incarcerated and they had first started doing TB testing, and we had no trust. Like, literally, what are they trying to inject us with? Are they trying to kill us off? And so there's this level of distrust that we have, and that's going to be an issue inside these institutions. Why should we trust that this vaccine is actually going to help us? And so I say that on one hand, and on the other hand, I also understand that if we don't take the vaccine, there's the likelihood that you could be unaffected. And of course, the likelihood, just based on what we're seeing, not just here in America, but all around the world, that you could suffer and possibly die from it. Mm-hmm. But what safeguards do we have? And what safeguards do the people inside have to know that this is actually something that we should consider doing?
So I think you've hit the nail on the head, Sam, because this is exactly the question that we need to be talking about now. Where an issue that shouldn't be controversial has become controversial because of the deep history of mistrust and mistreatment that has been around, not only in correctional institutions, but with regard to poor communities and communities in color in general. I'm seeing a lot of this on my feed. And in fact, I totally understand where this is coming from. I remember that just a few weeks ago, Brendan Woods, who's the public defender for Alameda County, tweeted, his opinion that the folks that are incarcerated should be getting the vaccine first. And my initial thought, the minute I saw it, is, you know what? If I were doing time in a CDCR institution right now, and after everything that's happened in the last 9 months, somebody from CDCR came to me and said, we want to give you a vaccine, I would have no reason to believe them, like, with everything that's happened. And there's a rich history behind this that's not just about this pandemic. Let me explain a little bit what I mean. So as early as 1906, even as early as that, the tropical medicine experts at Harvard were giving cholera vaccines to people in prison, causing people to die. In 1915, they were studying this disfiguring disease, and they were giving people treatments that make them extremely sick. Even at Quentin itself in the 1920s, there were horrific treatments going on to kind of like all kinds of experimental stuff. But you don't even have to go that far back. Many people on this call probably remember that just very, very recently, we saw CDCR doctors non-consensually sterilizing women who were incarcerated. Like, what more do you need to not have any trust in what is going on? So all of which is to say is, I completely understand and get where the mistrust is coming from. Now, here's the thing. There's 2 aspects to the vaccine, right? There's the medical aspect, right? Making sure that the vaccine actually works. But the vaccine is only as good as its distribution in the population. So any public health campaign where you try to vaccinate big swaths of the population has to have a public education and outreach component that guarantees buy-in from the population. This, by the way, is not a problem just in prisons. We're going to see this problem nationwide. We have tens of millions of people in this country who, for various reasons, are suspicious of vaccines because they're anti-vax, or they think that this pandemic is a hoax, Or, like many incarcerated people, they feel that they've been on the receiving end of all kinds of horrific experiments and they don't want to be guinea pigs. Like, we're going to have a big problem. And the way to deal with this problem is to have credible sources, people communicating to the folks that are, going to presumably be taking this vaccine, that you really do have their best interests at hand. And what frustrates me about this is I get why this is controversial. Normally, if you were dealing with people who had your best interests at mind, this wouldn't be controversial at all. The problem is that from the beginning of this pandemic, from March, at every opportunity that CDCR had to engender goodwill, to show people that they care about them, to show that they prioritize the health of incarcerated populations, at every junction, they did exactly the opposite. They had the opportunity not to transfer people. What did they do? Transfer people without testing them. They had the opportunity to model good behavior with masks. What did they do? Allow the guards walking around without masks and not penalize them for it. Just like at any point. Just this morning, the Chronicle has a horrific story about what's going on at SATF. And it turns out that one of the guys had the prison authority, the prison officials put another guy in his cell who was COVID positive. And he said, hey, this is not okay. I don't feel safe. I'm going to be infected. What did they do? They handcuffed him. See, what I'm saying is at every point, they've done exactly the opposite, which is why we're now going to face this uphill battle. It's like the boy who cried wolf, right? If at any point you're telling people, I don't care about you, I don't care about your health, I don't care about your life, if you're now going to turn around and you're going to say, we want to vaccinate you for your own good, they're not going to be believed. And this is exactly the gap in trust that they have to be working at bridging, and they have to do it right now.
So on your screen, thank you for that, Professor. That on your screen, viewers, is the actual article that the professor is speaking to. And when we stop and think about this, right now with the pandemic just seemingly out of control across the nation in California, I would think the smartest thing to do right now is what CDCR had been doing: freeze movement. No cell moves, no transfers in, no transfers out. Only if you're being released, and if you're being released and you test positive, then there's a quarantine period in a hotel that is paid for by the state or a community-based organization. But literally freeze all movements until we get this thing under control. Like there should not be people being placed in cells or transferred or being brought from the county jail to the state institution until this is at least until the vaccine is available. And so that kind of goes into my next question. So first, there's a question in the chat box, and just want to clear this up. Is the state currently considering including the prison staff in the first stage? And if not, how do we get them to consider that? That's from one of our viewers.
So I don't know whether they're prioritizing prison staff specifically. I don't have any information about it. The only information that I have from the report is that they're prioritizing healthcare staff. And the reason this is important is, okay, so there's a few things here that we have to think about. The first one is this: if people who are incarcerated are understandably mistrustful of, whatever CDCR is going to try to, pawn off on them, even if the vaccine is actually fine and can save lives, people are going to be mistrustful. What better way to engender trust than to have the correctional officers get the vaccine first, right? But here's the problem. There's two professional unions that deal with people who work with prisons. There's the Prison Worker Union, SEIU 1000, and there's the Correctional Officers Union. And those are two completely different animals. The prison workers would be first in line to take the vaccine. They've been extremely vocal and forceful about the risk of this. They've been advocating for releases, and they even filed a grievance against CDCR a few months ago about their own work conditions and the way it's endangering people. Doctors in prisons, I'm talking about the rank and file doctors who are working to save lives despite the situation, are being extremely courageous, kind of coming out and speaking against what they're experiencing. So this is one variation of this, and I don't think there's going to be any problem with buy-in from that direction. My concern is what's going to happen with correctional officers. Now, I don't know what's going on at CCPOA, but I can talk about what I'm seeing. And usually what I do is I follow the money, because where people put their money tells me a lot about what they need. What has CCPOA done for its correctional guards in the last few months? They've had hundreds of people get sick. They've had one sergeant die, right, back in July. And despite that, you go on their website, there's not a word about COVID. You go to their media and the press releases, there's not a word about COVID. All they've done was spend $4 million coming into November on all the punitive propositions that were on the ballot, like Prop 20 and all that stuff that didn't pass. So I think that that union is completely in political capture. They don't actually care about the health of their members. What they care about is to kind of like roll back all the reforms that we've done and make the state more punitive. Also, my concern, and again, this is something that I don't know, I'm just seeing this in the Inspector General's report, that there might be a hotbed of COVID denialism among the rank and file of the folks who actually work in prisons, because otherwise, how can you explain somebody working at a pandemic incubator and not wearing a mask? And when they brought in the doctors to talk to the assembly member Phil Ting was asking him, like, how did you not punish these folks? Like, how did you not suspend people that are walking around prison without protection? The doctor said, I guess we just hope that they would do the right thing. Well, the hope is hollow. They're not doing the right thing. And I worry very much that this reflects some sort of like rampant attitude of COVID denialism that's going to be a big problem in buy-in. One of the things that CDCR has to do, and this needs to be very visible and very open so that the incarcerated population sees that this is happening too, is communicate very, very clearly to the prison guards union that a person who steps into a CDCR facility without wearing a mask has no business working for CDCR. Like, that message has to be very, very clear. And I think if that happens, if there's goodwill engendered and people see that the staff, after all, consider also the fact that even in places that have lockdowns like Vacaville and other situations, the people that are moving freely around the prison are the staff. You could already do a great deal of containment if you start with vaccinating the staff. But again, you have got to earn the buy-in to make this actually happen, because the vaccine is only going to be as effective as people actually taking it.
So first, thank you again for that, Professor. A couple things I want to just mention. So I have a team of former life prisoners that go inside and run rehabilitative programs called the Hope Redemption Team. And we met this morning. And I just want to shout them out because we were debating this particular topic. And two of them, Jacob and Carlos, both said the way to get trust from the population is for them to actually, for the population inside to actually see the staff getting the vaccination first. So just wanted to shout that out. And I agree with that 100%. So that's one. The second thing is, just as you have described, there should be some level of, I'll reword it as discipline for not using a mask. I remember sitting in and watching a hearing with Secretary Allison, and Assemblymember Jim Cooper was more focused on disciplining people that were in custody as opposed to staff. And I actually asked that particular assembly member, take a look at this and say, if we're going to discipline people that are in custody, staff need to have this same level of discipline. If you're not going to wear a mask, it's across the board.
Exactly. And by the way, this is exactly what drives me bonkers, because when I wrote yesterday's monster, I read dozens of parole hearing transcripts from the last 50 years, and people get dinged for the most mundane, tiny things that they did 10 years ago. Somebody had a quarter in their pocket, somebody had a plastic spoon, there's endless 115s, endless 128s. So where is all this kind of like appetite for disciplining people when the time comes to saving lives by expecting the staff to wear a mask? Again, all of this stuff could be done visibly, and it could be done in good faith to win people's trust, to kind of like try to remedy this breakdown in trust that has already existed and has gotten much worse in the last 9 months.
So my next question, to many it seems leaving prison populations out of the rollout belies the idea that lives of people in prison do not matter. What are the reasons why prison populations would be left out of early rollout? Are there any good reasons to do that?
I don't think so. I don't think there's any reason to leave anybody out. And I think that basically what we have here is just a profound misunderstanding on the part of the people making the policies of A, how prisons work, and B, how pandemics work. Because this whole idea that people in different places are not impacting each other this is just not the way prison works. Prison is porous, prison is permeable, people come in and out all the time. So I think that the basic problem that we have to face, and by the way, this is not just about pandemic, this is about everything else, is this idea that people don't just disappear if you can't see them. They're still alive, they're still there. Most of them hopefully are going to come out someday, hopefully sooner rather than later. And that has to be the plan. But I really want to talk about something that's a little bit more tentative. And I want to talk about this very carefully because I think this is something that we're all kind of thinking and we're not really openly talking about. And that is the concern that all the advocacy that we've done in the last few months, trying to get aging folks, trying to get sick folks out to be safe with their families and their communities, is going to be sabotaged because if they give everybody the vaccine, they're going to be able to say, well, we vaccinated the whole prison population. We don't have to worry about releasing people. And I understand where this concern is coming from. And here's why I think that we should press on with both the vaccines and the releases. So when the court ordered to lower the population in St. Quentin, and hopefully maybe the Plata litigation is going to end up with a similar order, for all the prisons in California, they basically left it open to CDCR how to do it. Like, do they want to transfer people? Do they want to release people? And there's this fixation, I think, of prison officials and folks at the Attorney General's office on this notion that people are dangerous. And this is not new to now. This is something that had been there for a long time before. And we saw this even more clearly back 10, 12 years ago when the financial crisis happened. Because here's what happened. The financial crisis happened. People realized that prisons were not just inhumane, they were also expensive. Plus, they were dealing with the Plata litigation, right? So, people were dying basically on a weekly basis from completely preventable conditions. And then what did they decide to do to shrink the prison population? They released the folks that they termed so-called nonviolent people. There is a false distinction that is extremely popular and represents deep misunderstandings that whatever you're doing time for is also a reflection of how much risk you pose. Nothing could be farther than the truth. There is decades of robust criminological evidence that the most important predictor of whether somebody's going to reoffend is their age. And of course, how much support they get on the outside. People typically age out of violent crime in their mid-20s, right? A quarter, or even more now that we've released some people, more than a quarter of the prison population is folks over 50. And as many of our listeners probably know, because the conditions in prison are so difficult and the healthcare is so abysmal, people age much faster behind bar than they would if they were on the outside. So these are folks that on one hand have almost zero risk to public safety. When I interviewed parole officers for yesterday's Monsters, the parole officers told me they love working with the older folks that have come out after long sentences because they don't give them any trouble, because they're mentors, they're wise, they calm down the population in the yard and they calm down the population on the outside, right? It's a win-win. You let these people out, they don't commit crime, they act as a stabilizing, mentoring presence on the outside, and these are exactly the folks that face a risk of contagion because they're older and they have medical conditions. But why is it that we're not focusing on this population and just saying, okay, man, 30, 35 years inside is plenty. Let's let these people out. Because there's this fixation on the idea that the crime of commitment that you committed when you were a teenager, 40 years ago, is informing the risk that you pose. And there's the optics of releasing people who are sentenced for violent crime. The amount of work that we have to do calling newspapers who have headlines calling people murderers. Yes, the person committed a murder. That was 40 years ago. They've changed in 40 years. They're not a risk to the community now. This is exactly the population they should let go, and they're doing exactly the opposite now. And this is exactly my concern, is that the more they appeal and they grandstand and they insist and they ignore the obvious category of people that need to be let out, the more difficult it's going to be to sell the vaccine to the people that are left behind who are not going to trust it.
So thank you for that. And in fact, we actually have had a couple of shows that spoke specifically to that. So one of the things, and numbers don't lie, math, I love science, I love math. So one, the category of life prisoners falls within that category of violent offenders. I would fall in that category. I would be one of those people that would not be considered. Now, we've now had over 10,000 people sentenced to life released. And here are the factual numbers. In the first year, they have less than a 1% recidivism rate. And in the second year, we have less than a 3% recidivism rate, lower than any other population in the state of California, the country, anywhere you want to look. 1% and 3%, you can't beat that. But because of, as you said, because of the commitment offense, they're not considering this. Now, here's another concern that has definitely come up, and I feel this concern. And so first I want to make ARC's position on this really clear. We want everyone inside to have access to this vaccine. So if a person says, I want the vaccine, they can be vaccinated. We don't want people to be forced to have to take it if they choose not to. And we say that because in society, if I decide I don't want to take the vaccination right now today, I don't have to take it. No one can force me to take it. That's my right as a human being to make that decision. And so there's some concerns about people that are incarcerated being forced to take the vaccine. What are your thoughts on this?
So here is where, and I'm calling to all the people that are watching and listening to us and want to keep our friends and neighbors behind bars safe. This is where we have to step in. If we come to the conclusion, and I think we will come to the conclusion that this vaccine is credible and that the vaccine actually has the potential to protect people's lives, I think the crucial thing is if people can't listen or won't listen to CDCR or to prison officials, you be the voice of science. You do your own research and try to figure out whether people are offered something that is really going to improve their health and save their lives. And if so, I think there should be some way in which those of us who have worked very hard for many years to have credibility with our friends behind bars need to step in, read the evidence, read the science, and give people advice that's 100% for their own good and on their behalf. And I think this is the role that all of us collectively are going to have.
Absolutely. I agree 100%. What do you think the challenges are going to be for actually getting buy-in from the correctional officers and prison workers for the vaccine rollout? What do we need to do to get their buy-in?
I think that the prison workers are going to be on board. I don't have any doubts that they're going to be on board and they're going to be first in line to want to get the vaccine when it's available. I think we're going to have to pressure CDCR very, very hard to work. I'm not really hoping that we have a lot of sway with the prison guards union, but I think we have to really pressure prison officials to be very strict with the guards and to just issue a very simple message. Look, when my kid goes to public school, there are some requirements about him being vaccinated. When my kid goes to preschool, they ask me to present a vaccination record. Of course, they are free not to vaccinate if there's exceptions in California or whatever, but the other parents also have to be protected. There has to be 100% crystal clear messaging from CDCR that if you want to be a COVID denialist and not get a vaccine is fine, but if you want to work at CDCR, you have to get a vaccine.
So from a question from our audience, and I can answer this question because I've actually been asking this. So the question is, aren't correctional officers' temperatures taken before they enter work? Yes, but a person, correct me if I'm wrong on this, a person could still have COVID and be asymptomatic, meaning you don't have a temperature, you don't show any signs, and I could give it to you. If I'm asymptomatic, I don't have a temperature or anything, I could still pass it on to you, correct?
Exactly. So first of all, we know that there's a large percentage of folks that have COVID and don't even know that they have COVID because they're not coughing, they don't have a fever, but they could infect somebody else and that other person can get sick and die. But that's only half of the problem. The other half is that in May, another report of the Inspector General came out, and it turns out that in half the prisons that the thermometers weren't working and people were not being asked questions. Or for example, they were only being asked questions in the place where the cars come in and not in the place where people come in by foot. So even the symptom, even as the symptom checking partial as it is, even that wasn't being done properly.
So another question, and this is a question that we actually have already addressed, but I'd still like to. The person asked, do we have to worry about our loved ones getting a write-up for not taking the vaccine? And a write-up meaning the disciplinary. And so right now, do you have any information on that? I have no information on that right now. But we are, as an organization and in collaboration with a number of other organizations, pushing forth an advocacy letter to the governor and to the health officials, saying that we want the vaccine to be available, but for people not to be forced to take it, and no disciplinary actions be taken against them if they should choose not to take it.
So I'm really glad that you brought this up, because there's two issues here and they're closely related. The first one is that there is a very long and atrocious history of medical things being done to people behind bars against their will. This is so the wrong way to go about this. And in fact, a big part of the problem with what was going on in San Quentin was about penalizing people for their choices. Like, for example, one of the things that the doctors from UCSF and UC Berkeley pointed out in their report in June was that when somebody reported symptoms or tested positive, they were being put in a solitary cell. People for decades have associated solitary cells with punishment. So it's a disincentive for people to even come forward and report the symptoms. Every time you tie up somebody's healthcare with punishment, you're going to get horrific results. Not only is it unethical and problematic, it also gives you exactly the opposite of what you want. The way to get people on board is to treat them like human beings, just like you. I like thinking about this. There's a colleague of mine, David Garland, in New York University, who once wrote this beautiful thing called Criminologies of the Self and Criminologies of the Other. That we're kind of like, sometimes we talk about crime as kind of like, there's an opportunity and anybody can do it. And, these people are rational, just like you and me. But the more dominant way people talk about criminology is kind of like, there's these other people and there's no way to reason with them. And my fear is that this is being approached as a criminology of the other. That people are not being treated like rational, reasonable people who can get the medical information and come to the conclusion that this is for their benefit. And I will tell you, and I'm this way, that I'm not, what I care about is not to be liked. What I care about is that lives will be saved. I will be first in line, me and my family, to take this vaccine as soon as it becomes available to me. And my most fervent hope and wish for you and all your loved ones is that you do exactly the same, because that is the right thing to do. But I think that people need to be in charge of that decision on their own and come to that conclusion on their own, because otherwise we're looking at something that could have wildly counterproductive outcomes. And this is why I think that the stance that you're adopting, where you want to give people the chance, has to be coupled. It's laudable and it's important, and it has to go hand in hand with giving people the ability to be captains of their own ship. Give them access to the materials, let them talk to people that they consider credible and on their own side, so that they don't get anything through the varnish of CDCR, which is already so tainted with suspicion.
And that literally goes directly to my next question. You've written that from a public health standpoint, outreach and public education must start now. The vaccine is not even available right now, but we know that it's going to be available shortly. And so what do you mean by right now, meaning exactly what you're saying? We need a robust education. And I think for my own, and I shared this with my staff earlier, for my own education, I watched the news when they talked about first stage trials and second stage trials. And I wanted to understand what those things were. So I took it upon myself to go to the CDC website and learn about vaccinations and the different stages. And so, for instance, for people that don't know, phase 3 means that thousands of people who have volunteered are given the vaccine to determine how effective it is. So when you hear Pfizer or Moderna saying it's 95% effective, you would say 9 out of 10 people that have taken this vaccine it's been effective with. So for people to just know that, that's information. But specific to the question I want to ask you, how do we make sure that people in custody get just as much information as people that are in the public, so that they can make an informed decision on if they want to take the vaccine?
So first of all, a big problem here is that life behind bars is already so stressful and scary and difficult that it's really difficult for people, on top of the basic survival that they have to do every day, to also kind of process information that's handed to them in these difficult technical terms. Like, when you're fighting for your own survival, you don't have the leisure of kind of sitting back in your freedom and engaging with this opportunity. So it's going to be really crucial to work with public health people whose job it is to do outreach and break things down in a simple and credible way that people can understand. By the way, this is not just limited to prison. This is, regarding the entire population. I'm not an epidemiologist, very few people are. So to break down the information in a way that people understand it is super important. The other is to find ways to disseminate the information. Our friends and neighbors behind bars don't have access to the internet. They don't have the leisure of time to, read a lot of things. And we have to find ways to disseminate the information inside so that it comes from channels that are regarded 100% credible. If the information is filtered through the messaging of CDCR, it's not going to work. It has to come from the people who have worked for years to earn that credibility. It has to come from the UC Berkeley and UCSF doctors who have worked their asses off to go into prison and to actually see what's going on and demand that people get released. It has to come from folks that we trust, that we and our loved ones behind bars think are beyond suspicion. So phone, print materials in some way to bring them behind bars in a way that it's clear that they come from credible sources, breaking down things. And by the way, not being deceptive about those materials, because simplifying and explaining doesn't mean being deceptive. If there are side effects, you want to explain what the side effects are. You want to explain what percentage of the population gets the side effects. There is no such thing as a vaccine that doesn't have any side effects. It's like every time, it's that the reason we vaccinate populations is because the benefit far outweigh the side effects. But all of this stuff, like, people are the captains of their own ship. Even though so much of their freedom has been taken away, they are still and should be the bosses of their own bodies. And they should be able to come to this decision on their own with information that they're going to deem credible.
So first and foremost, thank you for that. What do you think is the do you see the best scenario for incarcerated community members? What do you think you see as the best case scenario? Like right now, COVID is raging all around us. LA County is again shutting down, and then we just look right across the country. What do you think for people that are incarcerated, what is the best case scenario and what's the worst case scenario?
The best case scenario is exactly the scenario that I wanted to happen on March 1st. And the scenario is this: the Attorney General drops the appeal on von Steich, consents to a verdict of population reduction, to a consent verdict in Plata versus Newsom, and takes it on them not to kind of like quickly pick people here and there to let out, but as a group, take everybody over 60 or even over 55 or even after over 50 who's been doing long sentences, decides, 25 years is enough, and just lets these people as a group go home. Everybody around is going to see that crime rates are not going up because we know this population is not recidivist, right? So people aren't, writing all kinds of scare editorials in the newspaper. And then, which is also important, not only does this create immediate relief because now you can socially distance, but also people see that CDCR and the Attorney General care about them. And then when you come in and you say, we have the Pfizer vaccine for you, people agree to take it. And then everybody is healthy and safe. That is my dream. Now, between my dream and between what the Attorney General or the CDCR are going to do, there's a big distance. The worst case scenario is exactly what's happening now, which is that they're spending time grandstanding and appealing and petitioning and objecting and opposing and not releasing people. And by the way, this is something we haven't talked about yet, but keep in mind that the current population is being kept at its current number in an artificial way because they've stopped the transfers from jails. We now have hundreds of problems that we haven't even talked about throughout the state because jails have outbreaks too. Santa Rita has had a series of horrific outbreaks. Orange County, Fresno, there's countless problems in jails because of this. At some point, something's going to have to give. They're going to have to open the jail doors. They're going to have to bring some people out from jails to prisons. And the fear is that if by then there's no comprehensive release policy that allows social distancing, we're going to be exactly where we started. So the nightmare is what I'm living now. And the best case scenario is what I'm hoping I'm going to wake up to.
So we're getting close to time, but there's one other thing. So we did leave out jails, but I think it's important that people understand when we say we're focused on the Department of Corrections, but we also are inclusive when we talk about this vaccine being available for people that are currently in custody. That includes jails. The other thing I want to share with the audience is that we spoke about the trial of thousands of people taking the vaccine in the third phase. And one of the phases, or one of the companies, I'm not sure if it's Moderna or Pfizer, 60,000 people went through the third phase, meaning 60,000 people were injected with the vaccine to determine its effectiveness. And that's where they get to 95% effective from the 60,000 people that volunteered. And so these are not guinea pigs that are unsuspecting. These are literally people that volunteer to actually take the vaccine to determine its effectiveness. The last part I want to ask you, Professor, for people that are in custody, because it may be possible that after we edit this, we'll be able to send it inside the Department of Corrections for people to be informed and understand these questions. What would be a message to the people that are currently in custody right now?
The most important thing that I want to tell everybody who's behind bars right now is you are not alone. We are thinking about you. We are fighting for you. There are a lot of people who care about you and want you to be healthy and safe. Hang in there. Don't give up. We're doing everything we can to help. Listen to your own intelligence. Listen to scientists if you don't trust CDCR, and make the kind of decisions that you can that are best for your health and for your body.
And so, my thinking is along those lines. So I'm looking at everything that's going on around us. And so for me, this is just me. I'm going to take the vaccine. And it's because my mother, who's 82, I want to be able to hang out with her. Because my grandchildren, or my youngest grandson, who's not even 2 yet, I want to be able to hang out with him. I want to be able to hang out with my family, but I want them to be safe. So I'm going to take the vaccine when it's available. I also want to just make sure that people that are in custody have access to this. Oftentimes, I have to say this, if we think of it for Black and brown communities, if we talk about therapy, I don't need therapy. Very influential people who have money, they have therapists. If you think about tutors, I don't need a tutor. Very influential people who have money, they have tutors, and their children have tutors. Oftentimes, we don't go along with those things because those are things that we think are negative connotations. But if people who have money, wealth, and influence want this vaccine, I'm pretty sure I want the vaccine too. That's one reason. The other reason is when you look around, it's like, this is something that we've never experienced in our lifetime. If you go back and you think about under the presidency of President Obama, we had Ebola, the Ebola scare. We had H1N1. All of those things were controlled because measures were put in place that were different from the measures that were put in place when this virus came out. And now we have a full-blown pandemic. So just for me, I'll be taking the vaccine. And I'll probably make sure that it's filmed when I take it, because I want people to know that, for me, I think it's important to do it. But I want people to be informed when making their own decisions. Professor, any last thoughts that you want to share with our audience? And audience, if you have any other questions that you want to put in concerning the vaccine, the implementation, please do so now. But last questions for our audience, Professor? So
just to let everybody know, I know that there are a lot of people on this call who have dear people and loved ones behind bars who are going through all kinds of difficult times with jobs, with money, with even housing to put a roof over their heads. These are really, really difficult times. Please know that you're not alone. Please know that you're not alone. And I so hope that help is on the way.
Thank you so much. Thank you for the work you do. Thank you for representing people that are in custody that normally don't have a voice. Thank you for being our ally in this fight to change mass incarceration. We do have one question from Stanley, one of our ARC members. He would like to know, do we know what the side effects are? Have we learned what some of the side effects of taking the vaccine might be?
I don't know enough. I would have to read. And I think that as the vaccine becomes available, there's probably going to be a lot of public education being done. I'm going to probably trust my friends at UCSF and at UC Berkeley. There's probably going to be a huge effort at public education. Anything that I have or that I know that's important for us and for our loved ones behind bars to know, I'm going to put on my blog, hadaraviram.com. And I invite all of you to go there, and I'm just trying to put out things there that might be useful to everybody. again, I'm not an epidemiologist. I'm not that kind of doctor. I'm a different kind of doctor. And so I'm going to do what any of you is going to do, what any person of intelligence and curiosity is going to do, is that's, read the science.
Thank you so much. Professor Hadar, thank you so much for being with us. Thank you so much for sharing with us. Next week, we'll have another amazing topic that we'll be going on. All of the information about Professor Hadar and her articles are available on our Facebook page, our Instagram page. We'll post them. Any information can also go to her blog so you can learn more. I think the most powerful thing that we can do for our loved ones that are inside is to become informed so that we can inform them. Knowledge is power, and from power, we can make informed decisions. Everyone else, please take care, stay safe, and God bless. Thank you, Professor, for joining us once again.
Thank you.